In just the past 2 weeks, influenza has spread rapidly across Missouri and Kansas, with activity levels in both states being the highest on record this early in the season in the past 8 years. With flu, RSV, and COVID, it's important to get seen as soon as you start to feel under the weather and to know your care options. Thanks for joining us for this week's Health News You Can Use. I'm Stephanie Peplinski. Today, we're talking about the same-day care options offered at St. Luke's to help you get seen the same day your symptoms start. With me today is Dr. Todd Fristo, a primary care physician with St. Luke's Physician Group. Dr. Fristo, thank you so much for joining me.
Thank you for having me.
Dr. Fristo, we've seen a lot of illnesses circling around. Describe what we're seeing here in Kansas City.
Currently, we're seeing quite a lot of influenza A with a smattering of influenza B. A little earlier this year than some of the other years in the recent past. We're also still seeing COVID kind of float along. It's kind of steady, but not really increasing that much right now. And we are seeing quite a lot of RSV in the very young and some of the elderly patients. And occasionally, we still see some strep infections as well.
Why is it so important for people to get seen right away and not wait right now?
Well, with these particular viruses, there are some treatments that if you catch it early can make a big difference, help you recover more quickly, get back to doing what you want to do a little more quickly. So if you get early testing, that really helps. For instance, with influenza A, if you catch the diagnosis within the first 40 hours, there are some very good therapeutics that can help you feel a lot better, a lot more quickly. Same way with COVID-19, there are therapeutics if you catch it within the first 5 days.
What options does St. Luke's have for the community for same-day care?
Okay, fortunately, there are several options. There's the on-demand virtual visit or video visits. There's also convenient care clinics, which are located in the supermarkets around the area. And there's also walk-in clinics affiliated with some of the primary care clinics within the health system. And then there are urgent care centers, which were for a little higher level of care. And then there's also the emergency departments, which really should be utilized more for serious medical issues such as severe shortness of breath, chest pain, severe abdominal pain, fainting, passing out, seizures, and things like that.
We are seeing so many people going straight to those emergency rooms right now when there are other options that could be utilized. Explain how some of these other same-day care options would benefit patients.
I think one of the big advantages for patients is you can get seen more quickly. Your wait times are much less because the ERs are somewhat overwhelmed right now with all the volume of patients coming in. So I think that would help. So you can get an accurate diagnosis more quickly. And once you get the diagnosis, you can get started on appropriate therapeutic regimens.
And how do you know if you should go in person or do a virtual visit?
Okay, a virtual visit is for a little less complicated illness. Like you say, for instance, someone has sinus infections and they know they've had that before. They could make a virtual visit and say, I've had this before. I think this is what's going on. And usually you can kind of tell by visiting with someone. Or another option would be if you think you have maybe a bladder infection, that's a very good option for that because that diagnosis is made oftentimes by the history.
Let's talk symptoms. So many of these illnesses have overlapping ones, which can make it so confusing for patients to figure out what they are battling. Talk me through the symptoms for flu, COVID, and RSV.
Yeah, it is confusing for patients to know exactly which one they're dealing with because they all have very similar presentations with oftentimes runny nose, sore throat, fever, headache, cough, fatigue, all of those things, and they can come at different times. Influenza oftentimes typically comes on very rapidly. Within 6 to 12 hours, you may be feeling fine, and then within 6 to 12 hours, you have high fever, headache, and feel really bad. RSV can present very similarly, usually a little more cough and runny nose with that. And then COVID can kind of go all across the board. It can sometimes come on very subtly and then worsen, or it can come on very rapidly as well.
Now, holidays are coming up. What are some things people should keep in mind when they're planning to meet in groups?
Okay. If you are coming down with something, typically a respiratory type illness, which we just discussed previously, it's important to know which one you have, because if you have loved ones that are susceptible, such as an elderly grandparent or a relative, or they have underlying medical problems, knowing what you have so you can reduce their exposure to that. Like say you do have RSV, you probably would want to stay home and not expose them. So that's why it's important to get an early diagnosis so you can reduce the risk to others.
Exactly. Any final message you have for today?
With unfortunately, respiratory viruses are inevitable. We're going to see them this time of year. It's really important to focus on staying healthy, which we talk about a lot. One is getting plenty of rest. Also, make sure you're drinking plenty of fluids and staying well hydrated. That just helps support your immune system. Also, it's important to wash your hands when you come in and out of a public place, and have the hand sanitizer in your car and your console. And when you come out of the store, go ahead and do that. Not to be paranoid or scared about it, but it's important to kind of reduce your risk. And if you are feeling ill or having respiratory symptoms, if you do have to get out, I would encourage you to wear a mask just to reduce your risk to others.
Well, thank you, Dr. Fristo, so much for joining us today.
You're welcome.
To learn more about St. Luke's same-day care options, visit stlukeskc.org/same-day care. Thank you so much for watching. We'll see you next time on Health News You Can Use.